I'm Tabitha Moret. I had Dr. Alderman, who I adore, and I had a breast augmentation done. Well, I'm a little anal. So I had met with 3 other surgeons before I met Dr. Alderman, and I had almost decided that it just didn't feel right and I wasn't going to do it. So the moment I walked in and met Dr. Alderman, I felt 100% at peace. I felt more like she was a friend, and the staff I just fell in love with. So it was eons above my expectations. It didn't feel clinical or impersonal. It felt like I was with a bunch of girlfriends that were being honest and truthful with everything they said. I talked to a lot of friends and got a lot of information about what they kind of felt, and just not to postpone it, honestly, because I kept saying, I'll do it later, I'll do it later, I'm not going to be selfish, I'm not going to invest that much money in myself. My kids need it, it needs to be for other things, but it was just that once I did it, I was extremely excited for that date to come and extremely pleased with the results. I never felt like I was too big. I felt like Dr. Alderman had done exactly what I wanted. So just to put yourself first. Absolutely. I was given written information to go back through. I was mailed packets in the mail that I could kind of review at my own leisure, and when it wasn't like, oh, I forgot that question, just when I was at home by myself and it was quiet. I got great information from the nurses that I met with. I felt very comfortable coming back a second time to have a few other questions answered that had come up between my first consultation and before my surgery. So I felt 100% open with the staff. My nurse from the procedure called me that night, and so did Dr. Alderman, so I couldn't have felt any more comfortable with how the procedure went. I went with saline. No real particular reason. Maybe possibly just financial was a big contributor to that. Okay, here's my total dork moment, because we all know this story. I was really nervous about surprises and not wanting to be bigger or smaller than what I had anticipated. So I bought a bra that was an easy to find, off the shelf, Walmart kind of bra that I knew I liked in the size I was, and actually stuffed it with socks in the dressing room at Walmart to make sure it was the right size. And then brought that bra in, met with one of the nurses, and we kind of worked with that bra to make sure I was going to get the size that I wanted to be. So I felt extremely comfortable before the procedure and after the procedure that I had gotten exactly what I wanted.